Namaskar. A very good morning to you on this Sunday. And we want this Sunday to be a very happy Sunday. And that's why we bring you Health Hour with Apollo 24/7's experts. Every week, we bring you an Apollo expert to this live show where you can ask all your questions and queries. You're welcome to do this on the YouTube chat box. You must be watching this on various Facebook pages. But if you want your query to be answered, join us on the YouTube chat and please text your question there. And while you type your question, I request all the audience to mention all the possible details like age, gender, and all the medications or any other questions in one question so that it's easy for me to place this question before doctor. All right, today we are going to give out certain discount vouchers and gift coupons. That's going to be towards the end of the show, and also wait for a nice announcement that we're going to make. So, चलिए आज का टॉपिक शुरू करते हैं. फ्लक्चुएटिंग एपेटाइट. कितना खाना टू मच है, कितना खाना टू लिटिल है, ये एपेटाइट के बारे में हम लोग बात करेंगे. डॉक्टर आशीष चौहान इज गोइंग टू जॉइन अस, हु इज अ जनरल फिजिशियन, सीनियर कंसल्टेंट इंटरनल मेडिसिन फ्रॉम अपोलो हॉस्पिटल सिकंदराबाद, तेलंगाना. 20 साल का डॉक्टर साहब का एक्सपीरियंस है एंड प्रोफेशनल मेंबरशिप्स है सर के इंडियन मेडिकल एसोसिएशन, थायराइड सोसाइटी ऑफ इंडिया, क्रिश्चियन मेडिकल एसोसिएशन ऑफ इंडिया, एंड ही स्पेशलाइजेस इन डायबिटीज, adult immunization, and his awards and achievements go like this: Indiawood Medical Excellence Award in 2016, Vaidishri Award, Vaidhi Shiromani Award, Certification of Excellence from Lions Club International in 2021 and 22, Dr. APJ Abdul Kalam Health and Medical Excellence Awards in 2021, and his research paper is the chapter which he published, Insulin Infection Immunization Insurance, an Ultimate Guide to Insulin, is published. So here's Dr. Ashish Chauhan. Good morning, doctor. Welcome to the show once again. Lovely having you here on Health Hour again.
Pleasure is all mine, Jansi, and I'm so happy to be here on Sunday morning.
Thank you. And I must say, Dr. Chauhan is not just an internal medicine specialist, but he always is promoted कि hospital से दूर रहो, मरीज मत बनो. That's your motto, na, doctor?
Absolutely. I try my best, and especially with platform like these of Apollo 247 and the online consultations which are available. It's in our effort, and we should be able to do it, is keep people out of hospitals scientifically, not through any kind of gimmick, but yes, providing the hospital at home through providence of investigations and medicines at your doorstep.
Perfect. Very well said. And with that, let me come to the topic of the day. जो हम अंदर डालते हैं, जो खाना हम ये बॉडी को फ्यूल करने के लिए देते हैं, दैट विल ईदर गिव यू हेल्थ और डिसीज. सो एंड कितना खाते हैं उसके ऊपर अगर कंट्रोल नहीं है, जो एपेटाइट हम लोग बोलते हैं, अगर उस पर कंट्रोल नहीं है, तो फॉर श्योर आई बिलीव दैट वी आर डूम्ड फॉर अ डिसीज, वी आर हेडिंग टुवर्ड्स अ डिसीज. सो व्हाट्स योर स्पेशलिस्ट एडवाइस ऑन दैट? Food as fuel.
Oh, yeah, very much. I think what you've spoken is very well. What we eat helps us in fighting a disease and helps us in build up a body. And what we eat also can give disease and can immediately help us in procuring many diseases, even cancer, because obesity is directly related to the cancer. So yes, eating and is a choice, and we need to take it professionally and properly.
Then let me come to appetite. किसी का appetite कैसे हम decide करते हैं कि ये सही appetite है? कि appetite is not hunger. कि जब हम लोग भूखे हैं, कितना खा पाते हैं, that is appetite according to what I understand. Do please give me some understanding on what is appetite and किसको हम लोग fluctuating बोलते हैं कि कभी बहुत खाने का मन कर रहा है, कभी कुछ भी खाने का मन नहीं होता है. How do we decide what is a fluctuating appetite?
Appetite is something, what we call it as a desire to eat food. If we have a low appetite, that means we do not want to eat foods. Khana samne rakha hai, acha rakha hai, and we don't want to touch it. And that's what happens in viral diseases. In case of COVID, in case of dengue, that's a season right now. So if you would have a low appetite, and if you are not taking care of that appetite, your body is fighting capacity for your
ओके आपका आवाज थोड़ा मुझे ब्रेक आ रहा है आवाज में. सो आई थिंक
more uncontrolled sugar, cholesterol, cholesterol and
डॉक्टर
all
डॉक्टर
this
कैन
so
आई
on and so
रिक्वेस्ट यू टू, आप जो बोल रहे हो बहुत ही इंटरेस्टिंग एंड वेरी इंपॉर्टेंट टॉपिक बोल रहे हो, तो आपका आवाज कट रहा है, तो
forth.
आई
I'm
विल
missing
रिक्वेस्ट यू
out.
टू रिपीट.
Speak.
आई वुड वांट यू, आपका स्क्रीन भी फ्रीज हो चुका है, सो आई वुड वांट यू टू प्लीज गिव अस दैट एडवाइस अगेन. कैन यू प्लीज रिपीट?
Up
या
here
आई
now.
थिंक yes, yes, doctor, please go ahead.
Yeah, so appetite is all about we knowing what we have to eat in the right moment at the right time. And it is important that we stick to eating what is necessary. And quite often in this COVID time or dengue time, we need to have a professional advice. So that is important. Now,
Hmm.
appetite is directly associated with a lot of diseases like that thyroid, like that even depression. If you're tremendously depressed, you may end up eating too much or you may not eat at all. So it's that can be extremes, and that's why it needs a help of a family. It needs a help of a your own professional help. It needs help of one of the most important person, your spouse, to be able to help you out providing the right kind of food at the right time. And
Exactly.
definitely it changes. I'm very much sure as a lady you will know in pregnancy time you may be
बहुत.
desiring to eat something you never touched, or you may not eat something which you
Eat some.
always like to eat. Yes,
जी,
yes, that's
जी,
what is
जी.
the appetite is all about.
Absolutely. So yes, Vishnu Kashyap, Mr. Gautam, Shailesh Mishra ji, Charita Prabhakar. Hi everyone. Thank you for joining us this Sunday morning on this. I'm going to take up all your questions very shortly. Before I take up the question, so ये जो fluctuating appetite है, वो physical health में कुछ गड़बड़ दिखाता है क्या आपकी कभी? See, let's leave around diseases or like something like you said covid or anything that is a short term illness, and also pregnancy which is a state, physical state for a short period of time. Other than that, if there is a fluctuating appetite, if somebody is not able to eat anything, which who doesn't have a desire to eat, or somebody who has cravings, is it trying to tell me that there's something wrong in the physical health?
Very much it can be. Now, let me start the question in a from the frame which is more appropriate. What is a good weight? So if we have the clarity about our weight and height, then probably we'll be able to address it well. Say,
ठीक है डॉक्टर.
yesterday I got an online consultation where somebody asked me, ki, sir, my boy is 5'11" and he eats less. So I was kind of ki, parents को हर समय लगता है कि बच्चे कम खाते हैं. I said, okay, what is his weight? And then they said his weight is 46 kgs. So for 5'11", 46 was very less, no doubt about it. So what is the normal weight? Height in centimeters minus 100. I think that's what probably help out Mr. Deshpande and Pooja to understand. First thing is to know what is the right weight. For any average gentleman who is above 50 years of age, your height in centimeters minus 100. For ladies who are between 5 to 5.5 of height, then it's 50 to 60 kgs. For gents who are usually from 5'5" to 5'10", it's 60 to 70 kgs is what is normal. So now, depending in terms of what is your weight, you will have to see whether you are fitting into it and whether you have appropriate appetite or not. I hope that reaches us a
So
point
it is
whether
fantastic. That gives us some clarity there to say we are starting from here. वो base बना
yeah,
दिया आपने. Yeah.
yes, yes, yes,
So
and then
what?
probably we may,
Yeah. Please go ahead,
no,
doctor.
continue, ma'am. Yeah, yeah, your
So
question.
if I have set कि ये मेरा बेस वेट होना चाहिए, जो अगर मैं कंक्लूजन पे आ गई हूँ, तो वहां से क्या हम ये कह सकते हैं कि ये एपेटाइट सही है या थोड़ा ज्यादा या कम है? हाउ डू वी एड्रेस दिस?
Okay. Appetite is actually it fluctuates. It fluctuates by season. It fluctuates by your thyroid, by your diabetes. It fluctuates by your mood and depression. So yes, you have a fluctuating appetite. In a viral disease, I have told you wouldn't want to eat when actually you should be eating more. So appetite definitely fluctuates, and that is what is the important part for the parents to know and address, as well as for the family members to know and address, as well as the doctors to know and address.
जी
Because
जी
medicine can be decided whether the person is eating more or person is eating less, depending in terms of what is the profile of a patient or a person is. So that
ओके
needs to be individualized. That's why the dictum which I keep telling everybody, it's nothing called as one size fits all. It changes. The same
जी
medicine which is working good on Dr. Ashish Chauhan may not well on another gentleman. So this is what we need
जी
to understand.
सुपर। तो मिस देश पांडे जी का क्वेश्चन के साथ शुरू करना चाहती हूँ आज के यूट्यूब क्वेश्चंस। हाउ टू डिसाइड व्हाट टू ईट और हाउ मच टू ईट मे बी इफ वन इज एक्सपीरियंसिंग स्ट्रेस एंजाइटी एंड लैक ऑफ स्लीप। तो इसके साथ मैं मेरा भी क्वेश्चन जोड़ना चाहती हूँ कि मेरे मूड स्विंग्स के हिसाब से मेरा एपेटाइट फ्लक्चुएट होता है। इज दिस नॉर्मल? डज आवर मेंटल हेल्थ हैव सम इम्पैक्ट ऑन आवर एपेटाइट?
Yes, very much, no doubt. Not some impact. It's got very much impact on what you don't want to eat, as well your stress levels. And number one is I would want relax, chill. If you don't want to eat, don't. If you want to eat, eat. Do not need to fight with your moods. Make you stay healthy. Okay.
जी
Intermittent fasting is very, very good for the body, especially for the non-diabetic patients, especially in the people where our society is suffering a lot with lifestyle disorders. Intermittent
जी
fasting is good. If you want to go only on the liquid diet, if your body framework permits you, if your height and weight are kind of correspondent to each other, your height is 165 centimeters, your weight is 68 kgs, you want to have an intermittent fasting, good for you. I would want to tell you very honestly to everybody on this public platform, fasting is good for the body, for the healthy body. Fasting is the way to live longer for a healthy body. It's not good
जी
if you have a tuberculosis. It's not good if you have HIV. It's not good if you have a diabetes. It's not good if you have kidney failure, liver failure, or the heart failure. But overall, for normal people like Jasi ma'am, like me, or like anybody else, a majority of our average population, fasting is good, and we must go for fasting whenever time permits. But
सुपर।
along with
while
every,
while
but
while can I add a question here, doctor? जब भी मैं इंटरमिटेंट
please,
फास्टिंग या फास्टिंग करना चाहती हूँ उस दिन मेरा एपेटाइट भड़क जाता है, ग्राउलिंग हंगर आ जाता है एंड आई क्रेव। सो ये क्या है? ये कुछ गड़बड़ है क्या मुझ में?
in a way, yes, in a way, no. I remember in the words what my mom used to say. Used to fast from 7 to 17 years of age. I kept those Tuesday fastings and I enjoyed that. And she used to say, "जब fasting ho to she doesn't feel like eating because it's all about tuning with the brain. You know, भूखे को हर एक चीज वो टिकेगी. You know, you see everything which is edible. So it is all about mindset. I've had a people who will say, "Sir, I can go to any sweet shop and not touch anything, not have a craving." So it changes from person to person, and at that particular time,
जी जी
discipline matters a lot. You have to train your mind whether you are going to say yes or no. And at this time, I would want to talk about one of the very blessed and very well-known, actor, Mr. John Abraham, and he is such a discipline in his profile. He says, "Ki sir, I like that kaju katli a lot, and I have not eaten for 25 years."
अरे
That is
वाह!
what we call as a discipline. Yeah, yeah. So whether everybody needs to have that, you will have to ask yourself. If you need to have that kind of profile, are you an actor? Do you need to maintain that kind of stature? Somebody in this question only I saw ask, sir, how do I get rid of my belly fat? The answer is discipline. You have to have a discipline of balancing diet with exercise, as well as assuring that you reach your goal. So life is all
जी
about having discipline in a balanced format.
ग्रेट। ठीक है, व्हाइल वी टॉक अबाउट ज्यादा खाने के बारे में हम लोग जब बात कर रहे हैं तो पूजा गांजू जी का भी क्वेश्चन यहाँ ले लेती हूँ। व्हाट कैन पॉसिबली हैपन? व्हाट आर द डिसीजेस दैट कैन हैपन बिकॉज ऑफ अंडरवेट? अगर कोई बहुत कम खाते हैं, तो अगर अंडरवेट होते हैं तो उनका क्या हो सकता है?
Poojaji, hats off for asking this question because India may underweight is a big thing. 20 crores people sleep every night without food. Statistics on Google. 8,000 people die every day because they don't get food to eat. With that statistics, if you're eating less, you can have osteoporosis because of low calcium, because of low vitamin D. You can have anemia. That is one of the disease which is kind of affects majority of our women population, and definitely you can invite a lot of diseases. Undernutrition and tuberculosis, which is a big killer, goes hand in hands, and that needs to be understood. So we need to know that under nourishment and eating less when your body needs more can be even fatal. So that needs to be addressed, and all the parents need to know this
To add
and need to
Pooja,
identify.
sorry sir, to add Pooja's details, वो मुझे next message में मिले हैं. Pooja has added certain other details if you can address them here. Pooja doesn't feel hungry at all. Her BMI is only 17.5 since many years, and digestive enzymes and syrups भी ले चुके हैं, but ज़्यादा help नहीं होता है. I'm taking Thyronorm as well. ये इनका थायरोनॉम कितना लेते हैं ये मेंशन नहीं किया है यहाँ पर. If you can add Pooja, it will be a great help. Suggest any test that in case you prefer. That's it,
She
doctor.
definitely seems to be needing a professional help.
Yeah, yeah. तो डॉक्टर
Okay,
चौहान तो
so
अपोलो
what is the
24/7 पे
thing is,
available है. हम्म. Yeah, please go ahead, doctor.
yes. So what she needs is thyroid causes either you will have a low appetite or you will have a voracious appetite. So having a TSH between 2 to 3 is very important. And mind it, along with thyroid comes other endocrine disorders also. It's usually because of autoimmune disorders which happens. If I'm missing it out, probably somebody can scribble it on the chat box also. But the funda to understand it is that disorders of thyroid do accompany other disorders like of diabetes, like of other endocrine disorders, and reaching out to the endocrinologist or to me or anybody else, a physician who's nearby, will be helpful
जी,
for you. So that you can
जी.
reach out to it. An
Yeah.
average BMI should be between 18 to 22.
Perfect. So next question I would want to ask is Shivang का question. Training with Shivang is asking, midnight cravings होते हैं. ये appetite से होते हैं या is this something else? Our eating pattern, sleeping pattern, या working pattern क्या दिखाता है ये? Doctor, can you hear me? For me on my screen, you are frozen. I hope you got the question. अगर आप हमारे साथ
If I have to,
okay, Doctor, I
so
would
that
want
is
you to
what we
start.
need to understand.
Doctor, please start
Yes,
again.
I believe you asked me.
Midnight cravings.
So midnight cravings happen to the people who are awake midnight, which is a bad pattern. You have to
Ah,
understand that you need to be awake only in the right kind of time. If you IT professional, if you're working with US and other client of yours, and you're awake in midnight, obviously you will have a midnight craving. So most important part for your good health is a proper sleep pattern of 8 hours. If you are not sleeping properly as per body requirement, the biological clock, awake, you will have a midnight craving. Please sleep by 10:30 and get up by 5:36. Follow 7 to 8
so what
hours.
about people who work in the nights? I work in the nights. अभी पूरा आईटी सेक्टर रात में काम करता है, जानना पड़ता है हमें. What about us?
Ma'am, life is all about proper discipline. So if you are awake in the night, definitely you need to have a food because obviously your body requires it. But make sure that you compensate for that, the sleeping hours during the daytime. The sleep is very, very important for a good appetite. There's somebody who asked me how to reduce weight, and I tell them 6 to 8 hours of proper sleep is needed for you to reduce weight.
जी, perfect.
Yes. So for
Yeah,
good control, sleep and exercise is very, very important. Anything in excess is bad. If you're sleeping less, you will be overweight. If you're sleeping more, you will be overweight. Both the things go together.
perfect. Thank you
So that
so
is
much.
what.
Yeah, yeah. Continue. You want to continue with the answer, doctor? Should I take the next question?
I am very much sure too many questions are coming, so we will continue with that one.
Yes.
How to take care of midnight cravings is, do not fight it out. Make sure your cravings is addressed with a small quantity. I usually order for what you call it as a sandwich, and I share it with my friend. Sharing is caring, and that will make sure that your body is maintained well. So do that way, but address it when it is needed.
Yeah. The days that I'm shooting in the night, the day that requires a night call sheet for me to work, I see that I'm eating a very healthy, nice, balanced meal around 5:30 to 7 ke beech mein. I eat real good meal so that it lets me work in the night without a refuel in the night. Is that a good thing to do, doctor, or would you want to advise me with something else?
Um, Specific situations require a specific way to address it. Okay. Now, my son, he's into rifle shooting. So now
Gee.
they've been told just the day before, when you're going for a championship, you are not going to eat anything from outside.
Acha.
You don't want your tummy to be upset. So that is a very right advice to be given. Then they said is, you have to have high protein food just before your training. So a specific situation requires a specific answer to be given, and making sure your food has got a more of a protein, less of carb, and less of fat is overall good for most of us.
Okay.
If you are
Done.
diseased by any chance, you need
Huh.
more proteins. If you are going for any strenuous work, you require more proteins. And definitely
Okay.
you don't want your diabetes and your dyslipidemia to worsen, so you want to avoid your carbohydrates as well as fatty meals. So that needs to be understood. Having a snack properly packed beforehand is something which is important to learn.
Great, doctor. Thank you so much for that tip there. I will make sure that I have enough good meal before I get onto a very rigorous work schedule. Next is Mishra's question in line to your protein tip right now. Is it safe to have a protein shake to reduce carbohydrate consumption for weight loss?
Mishra ji, dot to the point, you have asked a question and I'm very happy with it. That's one of the best way to reduce weight as well as to work on your, on your body weight. Now, remember one thing. You have to use your mouth more for chewing purpose, which is good for your dental hygiene as well as for your overall health. Because whenever you're having protein shake, you're saying no to something. Okay. Now
Yes.
remember one thing. A lot of people ask me, "Sir, should I take fruits, and or should I take fruit juice?" My answer is take fruits, not the fruit juices, because in fruit juices you miss out on that fiber which goes away in the whole thing. So protein shakes are okay, but personally I'll advise you, stick to high fiber diet. Stick to fruits rather than fruit juices. Though fruit protein shakes can be taken, but eating healthy protein is better. Egg is one of the best protein providers. Definitely you should avoid yolk if you are 20 plus, or if you have a diabetes or hypertension or heart attack.
Okay, great advice there from Dr. Ashish Chauhan. Next question is Charita Prabhakar's question. What to eat to lower cholesterol levels? आप ये डिस्लिपिडेमिया के बारे में जो बात कर रहे थे, appetite and cholesterol, does it have a connection, doctor?
Oh yes, very much. Appetite and cholesterol has got a lot of connection. Cholesterol, or should I say triglycerides, will be high if you have a thyroid, if you have a diabetes, if you are consuming alcohol on the regular basis, if you are having fatty meals. Because a lot of people have high triglycerides, and they will be asking this question. Triglycerides
Yes.
are high if you have a thyroid, uncontrolled diabetes, fatty meals, or alcohol. So you need to balance it out. That's what you need to understand. Diabetic dyslipidemia means high triglycerides and low HDL. That needs to be addressed. Whenever these two are abnormal, you will get a heart attack and you need to work on it. You need to contact your physician before it is too late.
Okay, okay, great. So next question is Vishnu Kashyap. Erosive gastritis के वजह से does erosive gastritis lead to vitamin D and B12 deficiency?
Very much, yes. Thanks, Vishnu, for asking that question. Why should you have an erosive gastritis? Say, first reach out that point. Why do you have it? That means you're having too much of spicy food, number one. That means you have a stress level which is not controlled, number two. That means you are taking pangas with your boss and a BV, number three. So make sure you are happy and smiling always. You should not have a erosive gastritis. Stop eating outside and stay smiling always. And whenever you think there is a vitamin D and B12 deficiency, take professional advice and take the supplementation before it is too late.
Ah, yes, doctor. I think it is an alarm that Indians need to set. कि टेस्ट करवाओ कि आपके विटामिन लेवल्स कहाँ हैं. व्हाट्सएप करो 9355247247. Apollo 24/7 is also available on WhatsApp. Now you can book your test, get simple tests done, and keep it at check. So here's next question from Mr. Harikishan Ramchandani ji. I'm at the borderline of diabetes and having a weight of 72 kilos, height 5'5", ideal diet चाहिए. ये प्री डायबिटीज एंड बॉर्डरलाइन डायबिटीज के बारे में now we'll talk about. You've been saying this कि
5'5", your weight should be 62 kgs, your weight is 72 kgs, 10 kgs, Mr. Mir Chandani, आपका weight ज़्यादा है, and you need to reduce your weight. How do we reduce your weight? It's very simple. एक महीने तक don't have anything which is cooked. Stay away from any cooked food for 1 month, and you will lose 3 to 4 kgs, and your sugars will go down. Your 10 kgs weight reduce your life by 10 years directly. You must act on your weight. And yes, if you consider yourself having diabetes right now, you will never get diabetes. So stay away
ah
from sweets, stay away from cooked food.
wow, what a tip doctor कि अभी अगर मैं समझती हूँ मुझे डायबिटीज है and if I start acting as if I am a diabetic person, so my life will be changed. Wow, what a tip there.
Yes.
Great.
See, the
ठीक है
biggest
next.
problem, what happens, Jansi ji, is people go to a doctor always once they have got into trouble. They do
जी
not come before it is the time. See, the way we have told, I forgot the number, I think 9335247247. If they order investigations beforehand, see, at this time, we see a lot of heart attacks also happening suddenly in young people because of COVID. I would
true.
want all the peoples to listen to this thing. They have to get the test done, which is from A to E. Okay, A1C, get it done every 100 days to live for 100 years. A for A1C. B for blood sugar, blood pressure, keep it under control. C is for cholesterol, C is for CRP, and C is for creatinine.
Okay, I'm writing it down.
Okay, D is D dimer, and E is ECG. Okay, now these investigations, keep doing it once in 100 days to live for 100 years. Very simple.
And anybody or any particular age that we need to start this off?
Very simple answer. If you think you should do it off.
Ah,
Don't bargain so much about it. Jansi, for you also, both of us look healthy and happy. Do it off. Do the tests before it is too late. We have had a
yes.
people dying. We feel uncomfortable that we are not able to save. That's what I say. No, we can save them reaching hospital. Let hospital reach you before it is too late. If anybody on the group, on the chat box like Shushmita or Johnson or Jayalakshmi, they should do the test. God damn it, please do it off. Your health
Okay.
at home is better than we seeing you in hospital. Very simple.
Superb advice there coming in from Dr. Ashish Chauhan. Next question is Raj Kamal Gupta ji. I'm unable to digest fat and so weight and energy near borderline sugar, digest fat. So he's putting on weight and no energy. Near borderline sugar, height is 165 and weight is 58 kilos. So 165 by
165, 58 kgs is good. I think you are within the
huh.
BMI. Your BMI will be around 20. So that's one part of it. You are not able to digest fat. You can be having a disorder where you are not able to digest it. If you are an Indian, if you're eating a lot and still not putting on weight, I sincerely think you need to rule out tuberculosis. You would need to rule out even other disorders like thyroid. So take a professional help that will be helpful for you.
Yes. All right. So next question is diabetes effect on appetite. दिव्यांश पांडे जी पूछते हैं.
Yes, Pandeji, diabetes affects your appetite. Diabetes affects the bowel movements. If I can very quickly go through it, diabetes affects from head to toe. So you need to balance it out. You must have a glucometer at home. Maintain your sugars between 100 to 150, 170. And if your sugars are controlled, you will live longer. So check sugars 100 times in a year if you're a diabetic, or once in 100 days if you're a non-diabetic. If you remember this way, that is good. How much you should eat if you're a diabetic? Remember one thing: no fasting, no feasting.
Okay.
Normal people eat 3 times per day. A diabetic should eat 6 to 7 times per day. Small, frequent meals is the answer.
సో ఇది ఒక్కసారి తెలుగులో చెప్తాను డాక్టర్ గారు. డయాబెటీస్ ఉన్న వాళ్ళు ఫాస్టింగ్ అంటే ఉపవాసము చేయొద్దు, ఫీస్టింగ్ అంటే మితిమీరిన భోజనం కూడా చేయొద్దు. అండ్
Yes.
మామూలుగా నాన్ డయాబెటిక్ వాళ్ళు రోజుకు 3 సార్లు తింటే, డయాబెటీస్ ఉన్న వాళ్ళు రోజుకు 6 నుంచి 8 సార్లు చిన్న చిన్న మీల్స్ ఫ్రీక్వెంట్ గా తినండి. అండ్ యూ వాంట్ టు యాడ్ సమ్ మోర్ ఇన్ తెలుగు, యూ క్యాన్.
No, no, ఇది మంచిది మాట మ్యామ్. వాట్ ఎవర్ యూ హెవ్ సెడ్ ఇస్ పర్ఫెక్ట్. డయాబెటీస్ ఎక్కువ తినడం కష్టం, తక్కువ తినడం కష్టం. సో షుగర్ మషిన్ ఉండాలి. ఎవ్రీ డయాబెటిక్ పర్సన్ షుడ్ హ్యావ్ అ గ్లూకోమీటర్ అట్ హోమ్. అండ్ ఎప్పుడన్నా మీకు డౌట్ ఉంటే మీరు షుగర్ టెస్ట్ చేయండి. దట్ ఈస్ వాట్ ఈస్ ద కీ థింగ్ టు రిమెంబర్.
Okay, great. Now we talked about diabetes and appetite relation. Here's Nitin Sharma's question. How does smoking and drinking alcohol affect our appetite?
Causes cancer.
बस
Smoking and
एक ही
alcohol
एक
directly
ఒక్కటే
causes
ఆన్సర్
cancer.
ఇచ్చారు. एक ही आंसर दे
That's
दिया
it.
बस.
That's it.
Appetite
There's
छोड़ो.
no doubt about it. So, smoking causing cancer and alcohol causing cancer is directly connected. I'm not here to promote alcohol, but definitely smoking is more dangerous, and you must stay away from it. Okay, I'm a strong promoter of the song कि मैं फिक्र को धुएं में उड़ाता चला गया. I like that song a lot overall, but that doesn't mean कि I tell anybody that they should kind of go into that habit. If you want to
हाँ
live longer and healthier and happier, you must stay away from both the things. Number one. Number two, it is if you are indulging into these habits, then keep doing tests more and more related to the lungs and to the liver and to the heart. Okay, so
जी.
this is what you need to understand.
Great. So here are two registered users questions. One is about hypertension, 132 by 90 or 120 by 98. It keeps fluctuating. Is it due to my eating habits? Then please guide me. Then Ramakrishna, who's
Yes.
35-year-old male, leg cramps होते हैं इनके बहुत frequently. Is this connected to my eating habits? So
Yes,
first,
number one is about the diet, the one who's got a blood pressure high. I saw all the three readings, both all three readings are high. The lower one should be around 80 and all three are high. That means you need to go to follow DASH, DASH, dietary approach to stop hypertension. You need to reach a dietitian or feel free to reach out to me on Apollo 247. We need to have a discussion on the long. You must stay away from salt. పచ్చిడి కొద్దిగా తక్కువ తినండి or uh, రూఖా
pickles.
సూఖా ఫీకా. These three things will make you to live longer.
Great.
So your PP
So
should be 128.
yeah. Next question is about leg cramps and frequent leg cramps, and is it related to eating habits? Ramakrishna.
It is related to eating habit also. It can be because of uncontrolled sugar. It can be because of thyroid. It can be because of low vitamin D, low vitamin B12. It can be because of calcium and magnesium. So multiple things. So దయచేసి you must do the blood investigation and make sure that you have all the reports within the proper levels. And definitely leg cramps happen because of dehydration also. మంచినీళ్ళు తాగండి. You must have lots and lots of healthy drinks and appropriate water, and exercise has to be balanced well. If you're exercising too much where you are having less of water, the dehydration can cause this. I hope that answers the question.
Yes, doctor. Next question is about a young child, 5-year-old child. I think we might not be able to address it in full, but quick brief. Rakshak thinks that the daughter, who is 5-year-old, is not having good appetite. He feels that she has craving for food, but दो तीन bite खाते ही appetite खत्म हो जाता है. Multiple cuisines that they've tried, she's marginally underweight and has immunity issues, frequent cold and cough. So I think it's a pediatric question, but still बच्चों के ये जो appetite issues होते हैं, we adults are more worried about it as parents.
Okay. Now I'll tell you the tips told to me by one of those pediatrician. They say, "Ki, sir, 90% of time we have to treat the parents, not the child. Child is happy and healthy and smiling. It's that the parents have too much of worries. So in this case, I believe you must stick and to whatever your pediatrician says. So you write down all the questions, go to pediatrician, get all of them addressed. And once pediatrician says कि child specialist says कि सब चीज normal है, साहब भूल जाइए आप. Don't worry about it. Trust your doctor.
Yeah, yeah. Okay. One question which I saw and I'm unable to reach back to the question is all about fluctuating appetite के वजह से cravings होते हैं इनके salt खाने के या chalk खाने के, उनका नाम मुझे दिख नहीं रहा है, but appetite disorders में ये eating disorders भी होते हैं क्या डॉक्टर? I'll figure out the name in
Yes.
between.
No problem. I think that's what it is. Eating disorders are like anorexia nervosa or bulimia nervosa or pica or rumination disorder. अब ये anorexia nervosa and eating disorders are the ones where people are normal weight or they are lesser than normal weight and they think they are fat. So they end up, fasting aggressively even when it is harming for their body. Anorexia nervosa is that. And bulimia nervosa is कि not only that they fast, but they have the binge eating, वो intermittently ज़्यादा खाते हैं, and then they try to vomit it out, they purge it out, or they take laxatives. So these are the psychiatric conditions, and that needs a professional help. They require a cognitive behavior therapy, which is what the eating disorder is all about. Now, eating chalk, eating in inedible stuff is a what we call it as a pica. Okay,
Yeah,
PICA is a
इनका
pica.
इनका नाम मिल गया है, क्वेश्चन भी मिल गया है. इनका नाम संध्या
Yes,
ईसाई है. Sir, can fluctuating appetite make us crave for slate pencils and chalks, or is it some vitamin deficiency for this craving?
it's usually because of the worms in your tummy. So every 6 months you must take a deworming agent, and definitely always with the consultation of a professional. But eating slate and pencil as well as chalk is very very common, especially with children, because obviously they eat outside ka food and they get the worms in their tummy. So we need to address it appropriately, and professional help is always useful in such kind of cases.
Okay, great. So professional help चाहिए तो आप अपोलो 24/7 रीच आउट कर सकते हैं, जहां experts है all around the clock, and 9355 247 247. You could WhatsApp as well now. Next question is two questions where who want to gain weight. Okay, one Jayalakshmi, उनका एज नहीं दिया, या 15-year-old है, she wants to gain weight. Divyansh is saying, Divyansh Pandey wants to gain weight with type 1 diabetes.
Okay, there are a few things. This is a slightly tough question. First and foremost, make sure that you have what is your height and what is your weight. Okay,
Okay,
best way to gain weight or reduce weight is a proper sleep.
right.
Okay, best way to gain weight or reduce weight is a regular exercise. Lot of things are on the hormonal level. If you want to reduce weight, exercise is good. If you want to
Okay.
gain weight, exercise is good. So make sure you understand that, and whenever is needed, take a professional help so that we can work on your thyroid levels, we can work on your overall any issues with your body. So once that is sorted out, probably getting a professional help will be meaningful for you. Because 15 years of age, better, I would suggest you must eat as suggested to you by your parents as well as your doctor. I do not think at this time you should be worried about it. This time you should focus on your studies, you must focus on your sports, you must focus on your skill development rather than anything else like this. Sports,
Fantastic
studies,
advice.
and skills.
तो हम लोग అవి సీదా 15 years నుంచి 77లోకి వచ్చేద్దాం డాక్టర్ గారు. ప్రభాకర్ రావు గారు నమస్కారం, థ్యాంక్ యూ మీరు జాయిన్ అయినందుకు. ప్రభాకర్ రావు గారు 72 ఏళ్ల వయసు, 167 centimeters height, 60 kilos మాత్రమే ఉన్నారు. మరి మీరు ఇందాక చెప్పిన లెక్క ప్రకారం హైట్ ఇన్ సెంటీమీటర్స్ మైనస్ 100 చేస్తే ఆయన అండర్ వెయిట్ ఉన్నారా? ఇస్ ఇట్ ఓకే ఫర్ దట్ ఏజ్?
It's absolutely okay. I'm jealous. I wish I can have that kind of weight. If you do not have a pathological reason for less weight, 167 height ki 60 kg weight is excellent because it falls between 18 to 22 of BMI. His BMI will actually turn to be around 20 or 21, which is perfect.
जी.
Overall, the thin people, okay, the thin people like Mr. Prabhakar Rao, or to that extent, Miss Jhansi Lakshmi, they live longer than Dr. Ashish Chauhan, who is on the fighter side.
No, no. Thank you so much for putting me on the other side. I want to come to this side. ये side आना है मुझे अभी. ప్రభాకర్ గారు థ్యాంక్ యూ. మీ వయసుకు చక్కగా మీరు ఆరోగ్యంగా ఉండి మంచి ఆహారం తినగలగడం ముఖ్యం. డాక్టర్ ఆశీష్, with this question, because I have elderly parents living with me, I'm always considered about their appetite. उनका बहुत ही कम खाना होता है, कभी खाने का मन नहीं होता है, అప్పుడప్పుడు తినబుద్ధి కూడా కాదు. ఇది కరెక్టేనా? మా అమ్మగారు 70 ఏళ్ల వయసులో ఉపవాసం చేస్తానంటారు. ఇస్ ఇస్ ఓకే ఫర్ దెమ్ టు ఫాస్ట్ అట్ దిస్ పాయింట్?
Oh yes, why not? I must say, if body can take it up, they should. Say, I hope I have addressed it appropriately. You should not fast if you have a diabetes, if you have a kidney failure, liver failure, heart failure, any failures. Okay, you should not fast if there is anything pathological in your body. But normal unte, you believe that you should fast, go ahead. Fasting is always good for the body, especially the healthy body.
Yeah,
Okay,
good.
that's one part of it. Now you need to make sure whenever there is a doubt, say me intro for your parent, make sure you have a BP, sugar, and saturation machine at home. And when there
Yes,
is
yes.
a doubt, you must keep checking it. Yes.
Great. And also age related fluctuation of appetite, is this normal, common
It's
as we
absolutely
grow?
normal. You should not force. You should not force anybody. If there is no pathological condition, they don't feel like eating it, I think that should be taken normally. Don't worry about it. But if appetite is low, you need to be careful that they don't have an infection. At this
Yes.
time, dengue will not cause a fever, but will cause a poor appetite. Suddenly, you don't want to eat. COVID can only cause poor appetite, will not cause any fever.
Okay.
So you can
Okay.
turn to hypoglycemia. So like that,
Yeah.
you'll have to understand that you make sure you are not missing out some infection. So you need to check that
Yeah.
out.
Super. So here's a question about fatty liver. I know Sushmita, you've been waiting with your question very patiently. Thanks, Sushmita, for waiting. Fatty liver के बारे में अभी बात करते हैं. So understanding is Sushmita is 29-year-old, 5 feet height, 84 is her weight, which is slightly on the higher side. Also has thyroid, and ultrasound says that liver is fatty liver now. It started to store fat. Please give me proper guidance.
Yes, so Shushmita Mukherjee, Kyamun Ache. The thing is that you have got a fatty liver is only and only because of obesity. I would ask you to check your thyroid level. Probably you are hypothyroid. One time checking the thyroid test is not enough. Somebody with your profile, every 100 days you must check for your TSH. Even if the previous 3 times it is normal, you must check again the fourth time also. That's number one. Number two is you require professional help. Number three, probably even bariatric surgery is needed for you because you are young at this time. In future, with the 30 kgs of overweight, if I'm not wrong, I God believe it was 5 feet was the
5,
height.
80,
If
80 plus, 84.
yeah, so for 5 feet, you need to be 50 kgs. 30 kgs of overweight is obesity, or kind of it will fall into morbid obesity. What does obesity does? O is for osteoarthritis. O is for obstructive sleep apnea. B is for breast cancer. E is for endometrial cancer. S is for stroke. I is for IHD, or what you call this coronary artery disease. T and Y is type 2 diabetes mellitus. So obesity causes diabetes, and diabetes, if untreated, causes obesity. So I hope this acronym of OBESITY will help you out in knowing that you need to control on your weight.
Dear, thank you. Thank you so much. It's a wonderfully put message and advice there, Dr. Ashish. I must say, each time I talk to you, I get a little more richer with knowledge and experience. Thanks for motivating us further. Yeah. And next
And
question I take up, Doctor, is IoT Malik's question. IoT says, after having a meal, I feel very full, but at times again, I feel hungry within an hour or 1.5 hour. I do have blood pressure medicines. So ये जो खाने के बाद जो फिर से क्रेविंग आता है, स्पेशली somebody like me, डॉक्टर, आई शुड एडमिट, खाने के बाद मुझे मीठे का क्रेविंग बहुत आता है. सो इज दिस नॉर्मल? आई फील लाइक ईटिंग अगेन.
feel free to do that, ma'am. The If you're able to keep your psyche happy and healthy and smiling, that is more important. The only thing is you need to check if you're a diabetic, if you are overweight, then you need to change that craving from sweets to something else. So for
हाउ डू वी
anybody
चेंज?
over
विल आई बी एबल टू ट्रेन माई
uh,
ब्रेन टू चेंज द क्रेविंग?
Oh, yes, very easy. Very, very easy. You want to have the craving thing is you need a support of the family. Okay. You may be having, say, for all the women who have a husbands who are diabetic and overweight and want to eat a lot. पहली बात उनके सामने वो polarity sweets नहीं रखनी है. See, you need to have the environment which is supportive. Okay.
ओके.
So there are sugar free sweets which are available, so that
जी.
you need to work on it. If you're keeping 1 kg of sweets in front of me and you'll say, Dr. Ashish, don't eat it, I will say, look, it's impossible. So you need to have an environment which is supportive. See, a lot of people, I believe, because I'm in Hyderabad, we are the biryani lovers. And I tell people कि आपके मम्मी पापा को थायराइड है, शुगर है, and heart attack है, तो उनको बिरयानी नहीं खाना चाहिए. Now, sitting in the dining table, everybody else is having biryani and telling them कि आप मत लीजिए, that doesn't work out. Say what you need to, we need to treat everybody as a family member, and do not tempt them and don't keep it. Giving green leafy vegetable is a good thing. There are a lot of fruit, the foods which are available, which are sugar free. So those things can be consumed, can be taken. And definitely you need to have your own struggle, your own discipline, your own outcomes, depending in terms of how disciplined you are. That's important.
थैंक्स. सो आईटी, आई अंडरस्टैंड कि खाने के बाद फिर से भूख लगता है, तो इट्स मोर ऑफ ट्रेनिंग आवरसेल्व्स एंड ईटिंग राइट क्वांटिटी एंड क्वालिटी ऑफ फूड. सो व्हाट यू आर ईटिंग इन द अर्लियर मील, मेक श्योर. अगर डॉक्टर, आई नीड टू अंडरस्टैंड दिस पार्ट. जब मैं ओट्स खाती हूँ या कुछ बहुत ही हल्का सा मील खाती हूँ, आई एम फॉर श्योर इडली खाती हूँ तो भी मुझे बहुत भूख लगती है. ఒక ఒక 1 ఇడ్లీ 2 ఇడ్లీస్ తిన్నాక ఒక 1.5 2 hours లో నాకు మళ్ళీ ఆకలేస్తుంది. అది నాకు అసలు కడుపు నింపదు. వేరే ఒక ఫ్రూట్ తిన్నా, ఒక ఎగ్ తిన్నా, అది లాంగర్, ఇన్ఫాక్ట్ ఓట్స్ తిన్నా కూడా మళ్ళీ ఆకలేస్తుంది.
Yes, so that's a very, very acceptable thing. See, what happens is that's what we do in case of bariatric surgery. In bariatric surgery, we cut, we decrease the size of the stomach. So when we decrease, so that's why if you have a morbid obesity, probably bariatric surgery is the best answer. So
Hmm.
morbid obesity is BMI more than 35. BMI is height in centimeter divided by weight. Okay, that's what you need to understand. Weight square. So we need to understand: do we have a morbid obesity? Our time low, we require a bariatric surgery. We require even a psychiatric, therapy to control our, appetite, and all these things are very, very important. And we need to be working on it. Brain is a very big thing. Brain आपको बेवकूफ बनाता है, आपको brain को बेवकूफ बनाना है. If you learn that, that is important.
तो ठीक है, यहाँ पर मुझे श्वेता का क्वेश्चन प्लेस करना ही है. श्वेता इज 25-year-old फीमेल. My weight is now increasing, and fast food actually calms my mind and makes me happy. I'm also having thyroid from my grade 10. My family also has a history of thyroid. I'm taking all my medicines on time without fail, but fast food is calming me. What do I do? अब क्या कैसे ट्रेन करूं?
Ma'am, that's a way of Satan works. Ki the sin always attracts us or distracts us. That's how it is. Speed thrills but kills. That's a statement which
जी.
I'll say. Speed thrills but kills. So, because ma'am has talked about thyroid, I would want to address that thing. Thyroid affects mind, mood, sex, hair, and skin. This is what we
जी.
usually don't talk about it. Thyroid affects mind, mood, sex, hair, and skin. That's one part. Number one, for thyroid people, it's very easy to gain weight, but very, very tough to lose weight.
Lose weight.
So for the people who have a thyroid, the people who've got a diabetes, they need to understand that yes, work religiously on making sure that you have appropriate weight as per your height. Now the same
Yes.
thing, even type 1 diabetic question put by somebody else, he wants to put on the weight. I will say, do not do that. The type 1 people are lean people. If you maintain lean, you will live longer and happier. Do not try to put on weight. The time you put on weight, you are inviting many diseases. So I hope that communicates the message. Maintain your body weight as per your height. That is height in centimeters minus 100.
Great. So I'm almost coming towards the end of the show. So I quickly want to have quick tips on these questions, doctor. Not elaborate, but quick answers. Rajangam, 55-year-old male. What's the remedy for acidity? Same question by Mr. Krishna Kitur, who's also asking about foods which cause acidity.
Stress, spicy food, smoking, spirits. These are the four things which cause acidity. Stress, spicy food, smoking, and spirits, that means alcohol. These all four things cause acidity. And definitely, if there is an ulcer in the tummy, that will worsen an acidity. So, reaching out to your physician and taking the right kind of treatment is needed. I think that's what is enough for me to communicate.
Wonderful. And registered users question, I'm unable to sleep properly and I'm hungry all the time. How much sleep do I need? And does age affect the sleep and eating pattern?
Age definitely affects the sleeping pattern, and the more than the age, the Facebook and WhatsApp affects the sleeping pattern a lot. You must have to have a proper balanced diet as well as balanced screen time also. Make sure that you are into sleep hygiene of sleeping for 6 to 8 hours regularly. Try to
Ji.
maintain it. Shut off your social media by 10 to 10:30, and the morning 6 to 6:30. So if you're able to do that, you are blessed that you are not a doctor. You don't have to put on your cell phone in the night unless until you're police officials or stuff like this. If you're not, learn to switch off your cell phone. Okay, and do not charge it near your head, because there are a lot of radiation which will again affect your brain adversely. So have proper sleep to have a proper healthy lifestyle. I hope that communicates the thing. Whenever you're going, any disruption with sleep will cause you disruption of your appetite, so you need to balance that
Ji.
out.
Superb. So while we are talking about sleep, you were talking also about exercise. I am trying to locate somebody who exercises, how much to exercise, and while exercising, how to control appetite. In the meanwhile, while you answer, I'll look at the name.
Okay, it's for all the diabetic patients as well as others, it's called as diet. Your diet should be appropriate. D is for diet, I is insulin, E is exercise, T is tablets. If you want to live
Ji.
longer, especially for my diabetic patients, follow this acronym: diet, insulin, exercise, and tablets. Every diabetic patient requires insulin. When doctor suggests take it, do not try to say no to it. That's number one part. Number two is, I want to healthier, live longer. You want to live for 100 years, then 100 minutes of exercise per day.
100 per
Remember
day.
something, no pain,
I got the
yes,
question. Yeah.
no pain, no, Jajikaru, it is not too much. 20 minutes morning, 20 minutes afternoon, 20 minutes evening, and 40 minutes of walk post dinner. So if you split it up, it's good one and you will be able to match it.
I wish somebody pays me for doing exercise, doctor. तो मैं पूरा ठीक है जॉनसन जी पूछ रहे हैं जॉनसन जॉफ गुड मॉर्निंग डॉक्टर जी एंड लक्ष्मी मैम टेल मी द इफेक्टिव रोल ऑफ एक्सरसाइज it's timing on appetite fluctuations. So now please emphasize on exercise so that I get back onto my regime. Increase 25 minutes every day.
Yes. Yeah. So foremost, this exercise pattern has to be individualized because a lot of people are IT planners. You need to see it. You have actually done the right thing, because we've had a slight example of Puneet Rajkumar sir, who we lost. He was exercising. So that kind of thing,
Was
the
your try, doctor? Yeah.
of stress.
Doctor, your voice is
So
breaking.
don't jump into the exercise of, I want to go fat fit. You need to be checking how old are you, whether your body fits into that kind of regime or not. Remember, always steady wins the race. So you must start very slowly, consistently, which is important, and then only to reduce weight or to gain weight. Both of the things have to be done in the proper pattern. But please don't go into fat to fit regime of 6 weeks or 10 weeks. No, no, no. That's only and only for professionals, and that needs a proper, guidance to be done, and not for an average person like you.
Superb. Thank you so much. With that, I would want you to give us top tips to take care of our fluctuating appetite for diabetics or non-diabetics, or for a healthy person or somebody trying to lose weight. How do we control our appetite? Top tips from you, doctor.
Stay happily, stay smiling always. Be scientifically informed about whatever the good things are all about. Get the right information. It's not pandemic which killed many people. It's an infodemic which killed majority of people during the COVID times. Anytime you want to have the right kind of information, feel free to reach out at 247 or to me at 810-612-7475. But yes, work for your health, work on it. There is one thing you have to understand: you cannot live healthy if you're not healthy psychologically. And it's all the duty of the family member to make sure that you are staying happy, healthy, and smiling always. The last word: meditation and medication. These are the two things which will keep you and me and every one of us healthy, happy, and smiling always. I hope with that, you will get the right message.
Fantastic, doctor. Thank you so much. And season's greetings to you, to the upcoming holiday and the festive season. Merry Christmas and a very happy New Year to you, doctor. आपका mission जारी रखिएगा of keeping people healthy. I know there's a delay there. Thank you so much, doctor. And that is Dr. Ashish Chauhan for you on this Sunday morning, and for you all who joined us on this live session. Let me give you these coupons. The first coupon that we are giving away is code AskDoc150, ASKDOC 150. The coupon code is on the screen. Use this on Apollo 24/7 app. पहले download कीजिए app, and you can consult doctors, top doctors from Apollo. You can get up to 150 rupees cashback on online doctor consultation. So that was the code AskDoc150. And the next coupon we are giving away is a coupon FIRST3, FIRST3. Use this on Apollo 24/7 to order medicines direct from Apollo. Get up to 25% off on online medicine orders. And this is valid on the first 3 medicine orders above 1000 rupees. Wonderful. And then exclusively for our health, our viewers, here we are giving you the code HH247. You can get up to 199 off on doctor consultations with Apollo doctors, and up to 20% off on online medicine orders as well. This is in addition to the other coupons that we've given away. So go ahead, download Apollo 24/7 and get the maximum benefits. Also now, Apollo 24/7 is available on WhatsApp if you're ordering medicines or booking tests. Apollo 24/7 is just a call away. You can do a call or WhatsApp message on 9355247247 to avail healthcare services right from the comfort of your home. So that's it for today, and we are taking a small break this year because it's Christmas and the New Year. We understand you are all also taking a break, or maybe the festivities around the New Year brings a lot of hope. So we are taking a break on the Christmas and the New Year Eves. Sundays are for you. So please stay healthy. We will meet you in the new year, 8th of Jan, 11 a.m., we are going to see you. Everyday accidents and injuries and first aid. जो घरेलू घर में होते छोटे छोटे injuries and accidents and how do you take care? We'll be meeting you with an Apollo Health expert on 8th January, 11 a.m. And we will be revamping the show. People who are waiting for an announcement on the health quiz, जैसे अनमोल रतन जी पूछते रहते हैं, we will announce very shortly of what's going to happen with our health quiz. So have a great year ahead. Merry Christmas to all of you. Take care of your health. Stay safe. Namaskar. Thank you so much for joining us.